Welcome to the show, everyone. I'm your host, Dr. TJ. Aaron is out today. Today we have Nick Bodi. He's one of our nurse practitioners here at the Institute of Natural Health. And today we're going to talk about a topic around testosterone replacement therapy. We get a lot of questions around testosterone replacement, and I want to ask a few of those questions so we can provide some answers for that. So the questions that we get asked are those that are with testosterone replacement but are outside of the sexual benefits of testosterone replacement. So we get things like cardiovascular, energy, blood sugar, things like that. So that's the stuff we're going to talk on today. So one of the questions that I get a lot personally is, if I do testosterone replacement, is this going to increase my risk of heart attack? What say you, Nick?
Yeah, no, that's a very good question, and a lot of misconception out there with the general public, and even in conventional medicine. A lot of doctors think that it's kind of an old school way of thinking that they were taught in medical school, that with testosterone replacement therapy actually increases your risk for heart attack and stroke. But over the last 2 decades, what we've seen in a lot of the research, and I'm talking about meta-analyses here, where they're compiling multiple studies, not just one study, but they are looking at 19, 20 different studies and compiling all the evidence. And it's very clear that testosterone actually has quite the opposite effect on stroke risk, heart attack. It actually improves almost every measurement of cardiac mortality and morbidity that they study, including lipid profiles, blood sugar and insulin resistance, strengthening the cardiac sites. In fact, it actually helps activate genes of your cardiac myocytes. So testosterone works on multiple different levels, including the cellular genetic level. So,
well, we're done here. Wow. Yeah, this is the stuff. I think we talk about this to our patients a lot. Yeah. But I think there's just so much misinformation out there and misconceptions on what's going on that it's hard for them to believe. I mean, you're holding an actual study. Read the title of that study for our audience out there.
Testosterone and the Heart.
And read where the hospital is that came out of.
This is Houston Methodist Hospital in Houston, Texas.
So they just compiled this whole article, and it's literally all of the benefits of testosterone on the cardiovascular system. Yeah. Now, I want to change gears real briefly. I don't want to take up a lot of time today, but I want to change gears a little bit. You mentioned heart attack and stroke. Mm-hmm. Talk to us a little bit about the benefits of testosterone on blood sugar and diabetes.
Yeah, absolutely. So as I alluded to earlier, that what they find is when they compile all these research articles and they really dive into the evidence, they're showing that testosterone actually improves insulin resistance, type 2 diabetes, what they call metabolic syndrome, which is a combination of being overweight, having high cholesterol, and blood sugar and diabetes. And so it improves almost every marker, like I said, that they look at. And other things as well too is that it, because you're improving blood sugar and insulin, it helps with weight. And with very little risk, like I said, it actually can improve markers related to heart failure and stroke risk and everything.
So one other thing I want to touch on right there, and this is something I talk to my patients about, and I know you do as well, is when testosterone is not an end-all be-all by itself, right?
Correct.
Talk briefly about the importance, if you're going to do testosterone replacement, the importance of making sure you're exercising and moving your body and doing resistance training, cardiovascular training. Talk about the benefits of that as well, or the importance of that rather, while you're doing testosterone. Because I always tell people, if you're just going home thinking testosterone is going to make you better, it's actually just going to sit there and make you fat.
Yeah, exactly. Yeah.
So talk about that for a second.
Yeah, I always tell people too, like the worst thing you're going to want to do is improve your testosterone or get testosterone replacement and then still sit around and do nothing, because then you're allowing the testosterone to go down pathways that you don't want it to go down. So testosterone replacement can be an amazing needle mover for a lot of people and get people unstuck from that rat wheel or that whirlwind effect that they're on. and get people motivated to get them exercising to help with the blood sugar and insulin resistance. But at the end of the day, you still have to put in the work. You still have to change your diet. But it can just really help with the motivation to do those types of things. But,
Sure. All right. I got one last topic. I want to throw the grenade.
Yeah.
Talk a little bit about the benefits of testosterone replacement for individuals with either prostate cancer or the risk associated of testosterone replacement therapy with prostate cancer.
Yeah, absolutely. That's a really good question, and a question we get a lot of, because again, I think there's a lot of misconceptions out there with conventional medicine and the general public. I think that we've all been told over the last several decades that hormones cause cancer, when in fact that's not true at all. That's just blatantly
and the
false.
Research proves that it's not true.
Correct.
Consistently proving it's not true.
Yeah, absolutely. And again, looking at different meta-analyses, there was a meta-analysis here that combined 19 double-blind placebo-controlled trials looking at over 1,000 men. A little over half of them were on testosterone replacement therapy, and the other were just on a placebo. And what they found was that there was no increased risk for prostate cancer between the two groups. So that right there alone tells you that testosterone does not cause prostate cancer, does not increase the risk for prostate cancer.
It's probably not even the driver of it either.
Yeah, and in fact some studies show that being super low in testosterone increases your risk for aggressive prostate cancer. So I think there's a lot of misconceptions out there, but then hitting again on your point is that you still want to be careful. You still want to make sure you're routinely checking your labs and balancing it with the estrogen levels and checking your PSA for the prostate and the blood, because there can be some issues that pop up whether you're on testosterone therapy or you're not. So again, you want to change your diet, you want to get your body moving, but testosterone can be a really great lower risk therapy that has a lot of benefits. So
amazing.
Yeah.
So that's about all the time we're going to take today. I appreciate you watching and listening. Thank you, Nick, for being here.
Yeah.
For Wellness One, I'm Dr. TJ. Erin, unfortunately, wasn't with us today, but for her as well.
I'm Erin.
Thank you so much. We appreciate you being here.